Welcome back to my channel Dentistry with Kashaf. Okay, let's discuss the part 2 series of arterial blood supply of head and neck. What is the anatomy of maxillary artery? And maxillary artery is one of the two terminal branches of external carotid artery, and it arises behind the neck of mandible within the parotid gland, and it supplies your deep structures of the face, nasal cavity, teeth, palate, and dura mater and muscles of mastication, and how you will see it here. Now this is the whole complex diagram, and we will see it and revise it at the end of this lecture, because if I tell you now, you won't understand it. Okay, what is the course of this artery? The maxillary artery begins behind the neck of mandible and passes through the infratemporal fossa, and it divides into three parts according to its relation with lateral pterygoid muscle. Okay, students, this one is your temporal fossa, and you have to remember that first part is called as mandibular part, second part is pterygoid muscular part, and the third part is pterygopalatine part, and you have to remember this thing, guys. Okay, we will see it now. You have to remember the mnemonic called as MMP, mandibular, muscular, and pterygopalatine part. How? See here. Okay, the first part is a mandibular part, which is posterior to the lateral pterygoid muscle, okay, which is just posterior. We said that we are going to divide it in three parts on the basis of in relation with pterygoid muscle. And now you see here is a second part called as pterygoid part, which is related to the lateral pterygoid muscle, means at that relation. And then the third part is called as pterygopalatine part, and it enters the pterygopalatine fossa through the pterygomaxillary fissure. Okay, what are the further branches? We said that it is divided into three parts. What are the branches of maxillary artery? Three were main. Then further, the three consist of further branches. So the first part was mandibular part, you all know, okay? And that consists of 5 branches. Don't worry, guys. This is nothing. Just to practice the diagram 3 to 4 times and you are going to master it. First, we are going to see. You see here is the mnemonic called as DEMIA. Basically, I didn't create it, but I got it from your ChatGPT. Yes, everyone's loving friend. And I love ChatGPT too. Okay, here you see DEMIA. You can spell it here. D-A-M-I-A. Okay, that is a deep auricular artery. That is your anterior tympanic artery, middle meningeal artery, inferior angular artery, and accessory meningeal artery. Okay, guys, relax. You are not going to just memorize it. You are going to learn it through diagram. We see it later. The second part is a pterygoid part, which is a muscular branches. That supplies your muscles of mastication. You know what are your muscles of mastication? Your temporalis muscle, your pterygoid muscles, your mesenteric muscle, and your buccal, which is basically not muscles of mastication, but that could be your expression related. Okay. Deep temporal arteries have 2 parts, anterior and posterior. Pterygoid branches are mesial and lateral pterygoid, and mesenteric, of course, the big giant muscles in your face, and the buccal artery supplying your cheek. Okay. The third part is a pterygopalatine part, and it has 6 branches, the most greatest and the most biggest one. So that is basically the posterior superior alveolar artery, anterior superior alveolar artery, there might be somewhere here, sphenopalatine artery, descending palatine artery, artery of the pterygoid canal like median artery, and pharyngeal artery. Also the most important infraorbital artery. Okay, I know, guys, you were a little bit bored by the description part, but let's move toward our diagrammatic part. Okay, let's revise it, student, what we just said in the description. Okay, the first I'm going to highlight in the yellow. Inferior alveolar artery, anterior tympanic artery, deep auricular artery, middle meningeal artery, and accessory meningeal artery. These are the part 1 branches. Okay, guys? Okay, the second part we said were what? Were supplying your muscles of mastication. Look here. Mesenteric artery. There are your pterygoid branches, medial and lateral pterygoid. This one is your deep temporal artery. This one is anterior. This one is posterior. Okay. Look at here. This is your buccal artery. So complete it here now. And the remaining are, of course, the branches of your third part, which was the biggest part and having 6 branches. Okay, let's highlight it in a very blue-green color. I like blue and green to highlight. Okay, let's see pharyngeal artery. This one. Your artery of pterygoid canal, also called as median artery. This one. This big one. Okay. And we already know that after passing through that canal, that artery is called as sphenopalatine artery. Of course, the important one is the infraorbital artery, which is further giving you branches of anterior superior alveolar artery, posterior superior alveolar artery, greater palatine and lesser palatine, which are the branches of your ascending palatine artery. Okay, this was a branch basically, but you can see these 2 are very important in dentistry too. And then these are the branches of your third part, which was called as pterygopalatine part. Now see here, there are some remaining parts like lingual branch, incisive branch, mental artery. We all know that these are the parts of your inferior alveolar artery, which is very important in dentistry. If they ask you, so you have to tell, but you have to remember the main branches in relation to maxillary artery. But if they ask specifically about the inferior alveolar artery, so I have already covered it in your mandibular nerve and in detail. Basically, the artery and the nerve follow the same course and same foramina and same canal. So basically, if you learn the nerve, you will learn the artery very easily. Here you see the mylohyoid artery. We see that inferior alveolar artery goes down and at the level of lingula that divide into two, like basically mylohyoid artery and this one, artery of the nerve, mandibular canal. Okay, let's proceed further. Can you solve this diagram? Yes or no? Can you do it? Let's try it, guys. This is very easy. Do this diagram very quickly. Okay, see. This one is your middle meningeal artery. This one is your deep auricular artery. And this one is your anterior tympanic artery. And remember the legend of dentistry, your inferior alveolar artery. Okay, then let's talk about the part 2 of this thing, maxillary artery. Number 1 is anterior deep temporal artery. That is posterior deep temporal artery. That is your buccal artery that supply your buccal area, your cheeks. These are the pterygoid branches, one to the lateral and the second to the medial pterygoid. And the 4 is a masseter muscle, your joint muscle here that is attached here. Okay, now moving towards your part 3. Part 3 is basically a very complex. You cannot understand it here. First, you learn to understand what is this. This thing is called as pterygo-maxillary fissure. That's why the third part is called as pterygo-palatine part. The second part you see, this one is your pharyngeal artery. This one is your sphenopalatine artery. This one is your infraorbital artery. This one is your anterior superior alveolar artery and posterior superior alveolar artery. And now tell me, where is the palatine artery branches, guys? Which was a part of your part 3? Okay. See here, this mini one, the 5 one, is your ascending palatine artery. Let's explain it here. If your ascending palatine artery coming here, and you know the palate consists of that foramina for lesser palatine and greater palatine. So you know that lesser palatine artery and greater palatine artery are the branches of basically this artery coming into your palate. Okay. Now quick review of this one. Part 1, part 2 and part 3. Can you do it? In I will say in just 1 minute, can you do it? Okay, let's start, guys. 1, 2, 3. Pause the video and solve it. It will take a lot of time. After solving it, you will learn it. Like, try to draw it. Try to learn it from diagram and then try to write in your exam. Okay, the middle meningeal artery, deep auricular artery, anterior tympanic artery, inferior alveolar artery. Very simple. Temporal arteries, anterior, posterior. Okay, buccal artery, pterygoid branches, lateral and medial, and this one is your mesenteric branches. This part is very easy. Basically, everybody knows the vessels of mastication. And the third part is also easy. Orbit, inferior orbital artery, infraorbital. Supplying your teeth, you know that anterior superior alveolar artery, posterior superior alveolar artery, palatine artery, ascending palatine artery. These two are a bit confusing. Somebody remember it or someone just forget it, just like I do. One is a pharyngeal artery going to your pharynx and the other is your sphenopalatine artery going into your nose and responsible for your epistaxis, your nose bleeding. And remember that middle meningeal artery in the temporal fossa here, if you are hit by this area or you just got an accident or just a severe trauma to the head, if this is lacerated, you are going to get some of the hematoma, which is a life-threatening condition, guys. One is this emergency epistaxis, the other was hematoma, and the third was this artery. If you lacerate this artery, cut this artery during your third molar extraction or any of your oral surgery procedure like for parotid gland or something, then you're going to damage this artery and this will cause you severe bleeding and you cannot stop it. As an dentistry, as a dental student or as a dentist, this is a complication for you. I hope you guys have got the idea about the maxillary artery when I was to you guys. Okay, what are the clinical importance of these arteries? Like very important arteries, you know that nose bleeding and your middle meningeal artery. So these are basically very important artery, you know, as a middle meningeal artery. Okay, if it torn out in your any accident or any fracture, you see here is epidural hematoma, and the sphenopalatine artery is a major source of your severe posterior epistaxis, nosebleed. Okay, and inferior artery supplies the mandible teeth, and it's important during the dental procedures. As a dentist, you know the importance of this artery very, very clearly. If you damage this during some of your oral surgery procedure, you cannot stop its bleeding. It's a very severe cause of bleeding in mandible. Okay, thank you so much for watching. Stay tuned for the third part, which will contain circle of Willis, like basically the blood supply of your brain. And don't forget to visit my Instagram account with Dentistry with Keshav and do subscribe my YouTube channel. See you next time. Till then, take care.